Summer doesn't just raise the temperatures, it stresses your heart too. Did you know the heart attack cases spike every summer? In today's video, I'll reveal 5 simple but powerful lifestyle changes that can protect your heart during summer. So what is the connection between summer and heart diseases? In summer, as the temperature raises, your body tries to cool itself. And how does it cool itself? It cools itself by sweating. And in order to sweat, the blood flow increases to the skin. And in order to do that, heart has to pump more. So thereby, in order to cool our body, the heart has to pump more blood to the skin surface. So from the skin surface, so there will be sweating and thereby there will be cooling of the body. So in summer month, heart has to pump more vigorously because of this phenomenon. Not only that, in summer, as we tend to sweat quite a lot, sweating leads on to dehydration, and thereby dehydration will cause the thickening of the blood because of loss of fluid, and this thickening will once again strain the heart because heart now has to pump against a fluid which is thicker relatively. So that's why heart has to pump more vigorously and it puts a strain on the heart. So these two combination, as we tend to sweat quite a lot and there is a dehydration, the heart has to pump more, and especially this phenomenon is very counterproductive in case of those who are already having a heart disease. Those who are already having a heart disease, or those who are diabetic, or those who are elderly, this can lead on to cardiac complication, especially heart attack, because heart is already damaged in those individuals, already is compromised, and top of it, heart is overacting because of this phenomenon, as well as there is increased risk of clot formation because of the thickness of the blood. So this leads on to heart attack, especially during the summer. Statistics have revealed up to 10 to 15% of the heart attack, there is increased risk during hot summer days, especially if the nighttime temperature also increases significantly. So if you like our channel, kindly subscribe and share it to somebody else. So not only heart attack risk increases during summer there are other heart problems as well, especially the blood pressure also comes down. Why? Because as we tend to sweat quite a lot, we tend to lose lots of water, and there is a vasodilatation. That means there is a relaxation of the blood vessels. Because of this relaxation only, there is sweating phenomenon takes place. So since there is a vasodilatation or relaxation of the blood vessels along with loss of water because of excessive sweating, the blood pressure comes down. So very commonly we see in our patients that blood pressure during summer comes down, and during winter, because of vasoconstriction, that means constriction of the blood vessels, the blood pressure increases. So during summer month, sometime we need to decrease or sometime eliminate also the blood pressure medication. Otherwise, patients tend to develop hypotension. So summer months, there is increased risk of heart attack because of this increased blood thickening as well as overworking of the heart. Second, there is increased risk of low blood pressure also. Not only that, summer month increases the risk of arrhythmia or irregular heartbeat. Why? Because during summer month we tend to sweat quite a lot, and sweating, not only we lose lots of fluid, but we also tend to lose electrolytes, especially electrolytes like sodium, potassium, magnesium, and loss of electrolytes can lead on to various heart rhythm abnormalities. Heart can start beating irregularly, which can lead on to arrhythmia and can lead on to even sudden cardiac death also. So as we have discussed, that summer month can lead on to lots of cardiac complication, heart attack, decreased BP, even syncope or loss of consciousness, and even sometimes various electrolyte imbalances causing heart rhythm abnormalities. As a practicing cardiologist, I tend to see all those symptoms quite often during summer months. So during summer months, we tend to advise patients to cut down on blood pressure medication, and we tend to adjust few of the other medications as well. So as we have discussed, the heart attack risk also increases by 10 to 15% during the summer month, especially if the nighttime temperature increases significantly. So having understood the risk of various heart disease during summer, we should take a preventive measures, and there are a few lifestyle changes if you do can save or protect our heart, especially during hot summery months, especially in a country like ours where it is a tropical country. We tend to have a very hot summer. We need to undertake all those lifestyle measurements. Especially we should avoid overexertion in the hot sun, especially around 11 to 4 am when the temperature is very high. We need to avoid overexerting ourselves. Even you need to go out we need to take enough precautions. We need to use umbrellas or use proper shades so that we protect ourselves from the sun. And we need to take good healthy food and avoid junk foods, especially very salty food, fast foods, alcohols, and especially sugary foods and drinks. In summer, we tend to take lots of sugary drinks, cold drinks, which are absolutely bad for health. It's not good for health because sugary drinks and cold drinks, these are basically loaded with sugar, and sugar, as we know, are bad for our health. Not only that, they tend to produce lots of diuresis also, especially not only sugary drinks and tea and coffee as well, because tea and coffee tend to produce lots of diuresis. That means the more we take tea or coffee, we tend to pass out more urine, and basically it can lead on to more dehydration. So we need to avoid sugary drinks, cold drinks, need to avoid tea and coffee, and obviously alcohol and junk foods. We need to take more often healthy foods, especially fruits which are high in water contents, especially watermelon and cucumber. So these are the two fruits which are high in water contents. So this can replenish our body with water as well as important vitamins and minerals. So avoid all the sugary foods and try to take healthy foods, especially water rich fruits and vegetables like watermelon and cucumber. Second is that we need to avoid dehydration. So dehydration is, already have discussed, dehydration even can lead on to various symptoms and can even lead to heart problems as well. Very commonly we tend to think that whenever we are thirsty, we are drinking water, because thirst is an indicator of dehydration. That's the notion. But thirst is actually quite late indicator of dehydration. By the time you are thirsty, your dehydration has progressed significantly. So if you are relying on thirst as an indicator of taking water, you are absolutely wrong. By the time you are thirsty, you are already dehydrated significantly. So during summer months, you need to hydrate or take adequate amount of water all throughout the day. How much water to take, that depends on various factors. So what are the factors? Various factors like what is your age, whether you are suffering for any other ailment like heart disease or kidney function, how much you are working, what is the level of your activity, and where you are staying. So all these factors needs to be taken into account when we are recommending how much water you need to take, because human body, up to 60% of our body weight is body water. So suppose somebody is 100 kilos, up to 60 kilo of his body weight is body water, and that's why water is very important for our well-being. And during normal processes also, day to day, we tend to lose around 2 liters of water through urine, through feces, through sweat. While I'm talking, I'm losing water. Even the process of breathing also, we tend to lose water. So all these processes leads on to loss of water up to the tune of 2 liters. Even normal conditions also, we tend to lose up to 2 liters of water through all these processes. And this increases significantly in case of hot, humid conditions. We tend to lose even more water. So that's why it is important that we need to replenish our body with proper water intake. And as we have discussed, thirst is quite late in case of dehydration. Before that, other symptoms of dehydrations are there. Very commonly, one of the symptoms is headache or poor concentration, fatigability, especially in the mid-afternoon. Whenever all these things happens in the mid-afternoon, headache, poor concentration or fatigability, we tend to think that our energy is down, we need to take tea or coffee. The moment we take tea or coffee, we tend to think that it will energize ourselves. Actually, all the symptoms are indicator of a dehydration, mild degree of dehydration. So if we take water, proper water, and hydrate ourselves, all the symptoms like headache, poor concentration, fatigability, all these things will go off. Rather, if you take tea and coffee will produce more diuresis and it will aggravate the conditions. So the moral of the story is that you need to take water all throughout the day, not only when you are thirsty. Even without thirst also, you need to take the water at a very frequent interval. So the next question comes, how much water to take and when to take. These are also very important, how much and when. Regarding how much water to take, general rule of thumb is to take around 2 to 3 liters of water. But that also depends. That depends on what is your age, that depends on how much work you are doing outside, that depends on whether you have other comorbidities, like whether you are having a heart problem, whether you are having chronic kidney disease, all those things are important. But especially a good indicator of proper hydration is your urine color. If you are passing a pale yellow type of urine, then it is likely that your hydration is okay. But if you are passing a very concentrated urine, very dark urine, then it's suggestive of that your hydration is not proper. You need to increase your water intake. So looking at your urine color is something which is very, very important. And one more important thing to keep in mind is that do not take very cold water, because very ice cold water will hamper your digestion process. So do not take very cold water. So that is how much water to be taken. The next thing is that when to take that water. That is also important. Especially when you wake up in the morning, first thing you can take is to sip around 500 ml of water. Because why it is important is that early in the morning, around 5 to 7 or 7 to 9 a.m., in that period of time, our large intestine is most active, and large intestine is trying to purge out all the toxins in our body. So if you take water, it will help in that process. So that's why early in the morning, if you take water, it is important. And after that, after waking up, first 12 hours after waking up, you should take water every hour up to 200 to 250 ml, so that per day it comes around 2.5 to 3 liters. Towards the last part of the day, 3 to 4 hours before sleep, you should cut down your level of water intake to not more than 500 ml in last 3 to 4 hours. Why it is important? Why initial 12 hours you need to take every hourly up to 200 to 250 ml, and last 3 to 4 hours you need to take only 250 to 500 ml, is that because of our kidney function. All our body organs work best in some particular time, which is known as circadian clock or circadian rhythm. And for our kidney, first 12 hours, the filtration fraction of the kidneys, that is the amount of the urine which is being filtered by the kidneys, are highest during the first 12 hours. So whatever you are taking first 12 hours gets filtered easily. But later part of the day, last 3 to 4 hours of the day, the filtration function of the kidneys comes down significantly. So that's why if you are taking much of water towards the later part of the day, you will tend to wake up at night in order to pee, and it will hamper your sleep. So when to take water is also important, like how much to take water. So hydration is very important in case of summer months to prevent any complications. Next, the electrolytes are also important, because only by taking water it cannot replenish your body. It cannot hydrate your body properly. Especially it is true to those who are working outside, those who are working under the hot sun, those who are going outside and working. For them it is very important, because they are not only losing water through sweat, they are losing substantial amount of electrolytes also through the sweat. Those who are doing a desk job inside an office premises, for them probably by only taking water is enough, because although they are also losing bit of electrolytes, but they are getting most of the electrolytes from their other food sources. But those who are working outside, they cannot just only take water, because they have to replenish electrolytes also, especially sodium, potassium, chloride, magnesium, because they are losing excessively, especially sports persons, like those who are playing various type of outdoor sports like cricket or football, or those who are working outside under hot sun. They need not only take water, they should also replenish their electrolytes as well. Otherwise, if they are taking only water, they will just pee out the water, so they won't be able to hydrate themselves properly. And lack of electrolytes in the body can lead on to various complications, like they can have cramps, they can have poor concentration, they can have even cardiac rhythm abnormalities and arrhythmias also. So that's why in those group of individual, it is important to replenish not only water, replenish electrolytes also. So how can they replenish the electrolytes? They can replenish the electrolytes by taking coconut water. They can replenish electrolytes by adding a pinch of salt to the water. They can take an electrolyte tablet or powder. By this, they can replenish the electrolytes, because these electrolytes, especially sodium, potassium, chloride, magnesium, are very important for our body, even for our heart as well. So especially we can take all these things, especially coconut water, which is quite popular in various parts of the country as a hydrating agent. But coconut water, you should remember, is very good source of potassium. Potassium is very abundantly present in the coconut water. but they are not very good source of sodium or magnesium or calcium. So this fact needs to be taken into account, especially those patients who are having a kidney disease. They should not take too much of coconut water because it's a very rich source of potassium. And somebody, if it is sweating too much, they tend to lose out more sodium than potassium. So by merely taking a coconut water won't be able to replenish their sodium. So they need to take some other source of electrolytes, either electrolyte powder or ORS or electrolyte tablet or maybe a pinch of salt. So all those things are very, very important. So all in all, these are the 5 lifestyle habits we need to follow in the summer so that it will prevent any complication, especially cardiac complication. Like you should hydrate properly, take adequate amount of water, and timing is also important, as we have discussed. Should take electrolyte supplementation, especially those who are working outside. You should monitor your pulse and BP, because pulse and BP irregularities might be there during the summer. BP might come down during the summer, so you need to cut down, maybe need to cut down your BP medication. You need to take healthy foods, especially fruits and vegetables which are rich in water content, like cucumber or watermelon. You should practice good amount of sleep and avoid sugary drinks, cold drinks, sugary drinks, alcohol, and tea and coffee. So if you like our content, kindly subscribe to our channel, and thank you all for your patient hearing.